This is the wave that we worried about back in spring of 2020.
Hamilton ICU Dr. Bram Rochberg regrettably says Ontario's hospital system is in real danger.
We can't keep up this pace much longer, and we're still on the upswing. We haven't even seen the plateau yet.
Data from Critical Care Services Ontario shows there's over 1,800 critical care patients in the province, 572 with COVID-19. Dr. Michael Warner, ICU doctor at Michael Garron Hospital in Toronto, posted this video today.
Unfortunately, the situation is going to get much worse. Now, on paper, Ontario has about 2,300 ICU beds. In practice, though, we have far fewer because we simply cannot staff them.
Included in a news release from yesterday, Health Minister Christine Elliott says, with Ontario's hospitals facing unprecedented critical care capacity pressures during the third wave of the COVID-19 pandemic, our government is taking immediate action to ensure no capacity nor resource in Ontario's hospitals goes untapped. The province issued 2 emergency orders yesterday. The first will allow hospitals during a major surge event the flexibility to transfer patients to alternate sites without obtaining consent. The second allows the redeployment of healthcare professionals and other staff who work for the province's community care agencies to work in hospitals.
There's concerns redeploying nurses from other areas that aren't comfortable with caring for critically ill patients. It's a challenge.
With these orders, along with the halt of non-emergency surgeries, the province expects to increase ICU capacity by up to 1,000 patient beds. This temporary field hospital being built here in Hamilton will be a provincial resource, another measure meant to free up hospital capacity.
All well and good to talk about opening up pandemic tents and new sites and new beds, but it's certainly so worrisome having the staff available to provide care for these patients.
Patients with COVID respiratory failure require higher levels of care, including a process called proning.
Those that are especially sick, we flip them a couple of times a day from lying on their back to lying on their stomach. It takes 6 people to flip one of our patients from their back to their front, and it takes about half an hour.
Dr. Warner is advocating that Ontario work with less affected provinces to bring their healthcare workers here with the help of the federal government.
If we find ourselves in a situation where they're doing elective surgery in Halifax and we're triaging patients in Toronto, that just can't happen. Let's break down the barriers now. Let's make the connections today.
Now, when it comes to load leveling for hospitals, the province has been doing it for months with consent of the patients or their families, transferring them from places like Toronto or Peel to Hamilton, Halton, and Niagara. To date, there are 79 patient transfers in our areas, 33 at Joseph Brant in Burlington. There are 35 in Hamilton, split between St. Joseph's and Hamilton Health Sciences, and 11 in Niagara. Back to you.